Now I'm going to be going over the LAFPP Medicare subsidy for members who are 65 and older. Okay, so Medicare is a federally subsidized health insurance plan for members that are over age 65. The cost associated with the entitlements, your coverage and doctors mostly stay the same. And then this works in tandem with your retiree insurance. Now, there's two main parts of Medicare. There's a Part A, which is your hospital insurance. This covers hospital services. To qualify for Part A free of charge, you must have earned at least 40 Social Security credits, which is about 10 years of work outside of the city. Or if you were hired by the city of LA after March 31st, 1986, which I think most of you fall into this category. So I'm assuming most of you will qualify for Part A free of charge. Or if you don't meet the first two criteria, you might be able to qualify for it through your spouse. Now, the second part of Medicare is Medicare Part B. This covers your regular doctor's visits, routine services, outpatient care. Everybody qualifies for Part B, and everybody must enroll and pay a fee. Okay, so 3 months before you turn age 65, our medical and dental section will be sending you or reminding you, letting you know, like, hey, your 65th birthday is coming up. Please do enroll in Medicare. You must enroll in Medicare's Part A and B. Only enroll in B, actually in A, if it's free of charge. And if you are enrolled in Parts A and B, you're going to receive the Medicare subsidy. If you are only able to enroll in Part B, then you will stay with the non-Medicare subsidy amount. Okay, so here's an example of a Medicare subsidy for a member only if you're non-frozen. So currently right now, effective July 1st of 2023, the maximum Medicare subsidy is $549.16. That's the non-frozen. The frozen is the $480.41. And this applies to members that are age 65 and older who qualify for both Part A and B. Okay, here's a side-by-side example of a Medicare versus a non-Medicare. So on the left-hand side, you're going to see the Medicare based on your years of service, the percentage that you would be eligible to receive, the non-frozen subsidy amount based on your years of service for the Medicare, and then also the non-frozen amount. On the right-hand side, it's the non-Medicare, and then with the percentages based on your years of service, the subsidy that you would be entitled to if you were not frozen, and then the subsidy you would be entitled to if you were frozen. Okay, for Medicare, the premiums are negotiated by your health plan administrators and health plans. In this chart, there is a lot of information on here. These are the current Medicare premiums for your plans. For more information, we do advise you to contact your health plan administrators, which for police is LAPRA. Okay, here's the premiums for fire, which again, these are very plan specific. It's just based on your situation, your spouse, your children, dependents. Again, for more information, contact your plan administrator. For LAFRA. For fire, it's LAFRA and UFLAC. As you can see, the premiums vary depending on the type of plan, the type of party, whether you are age 65 and your spouse is not, or if you're both in Medicare. So it's very plan specific what your out-of-pocket costs would be and what your premiums are.